Joo Yong Hahn, Mike Gibson coming to you live from ACC 2025. I'm really excited about what you have to say comparing clopidogrel to aspirin as monotherapy after PCI. A big question, what did you find?
In our Smart Choice 3 trial, clopidogrel monotherapy was superior to aspirin monotherapy as a long-term maintenance therapy among patients undergoing PCI after standard duration of the DAPT.
And tell me about the design in the study.
Yeah, this was an open label, randomized multicenter trial at 26 sites in South Korea. Between August 2020 and July 2023, 506 patients underwent randomization, either to clopidogrel monotherapy group or to aspirin monotherapy group in a one-to-one fashion. The primary endpoint was a composite of all-cause death, MI, or stroke. During a median follow-up of 2.3 years, the cumulative incidence of the primary endpoint was 4.4% in the clopidogrel monotherapy group and 6.6% in the aspirin monotherapy group. The difference was statistically significant. The benefit of clopidogrel monotherapy was mainly due to reduction in recurrent MI compared with aspirin monotherapy. There was no significant difference between the two groups with regard to bleeding complications. To our knowledge, our Smart Choice 3 trial was the first to demonstrate the superiority of clopidogrel monotherapy over aspirin monotherapy with regard to hard endpoint, including death, MI, or stroke in patients with high ischemic recurrent ischemic events.
And how long were they on DAPT before they switched to monotherapy?
Yeah, that's a very good question. The median time from PCI to randomization was about 17.5 months, a little bit longer than our expectation.
Okay, so this is really long-term chronic clopidogrel versus chronic long-term aspirin use. Interesting. So
Yeah,
this is well beyond a year.
yeah.
And who were these patients? Were they ACS, STEMI, non-STEMI, chronic, a mix of syndromes?
Yeah, we would like to focus on the high-risk patients. So the inclusion criteria was prior MI at the index PCI and medication-treated diabetes or complex PCI. So that's why the longer duration of DAPT was used in our population.
So are we ready to switch to clopidogrel from aspirin? And are you worried about people who are clopidogrel non-responders, particularly in your part of the world? So, Joo Yong, it's interesting. You work in an area where there's a lot of clopidogrel resistance, but still clopidogrel is better. So talk to us about that.
Yeah, I think the clopidogrel monotherapy does not need to be used in all patients because in some countries, still, clopidogrel is much more expensive than aspirin, including South Korea. But in patients with high risk of recurrent ischemic events, clopidogrel would be superior to aspirin. And I think the clopidogrel can be a first option in these patients.
All
And
right.
as you pointed out, our Korean patients have somewhat higher proportion of poor and intermediate metabolizer to clopidogrel. In our study, we exclusively enrolled the Korean patients, so the generalizability is needs as a caution especially to the Western population. But an exploratory analysis, we analyzed the genotyping, and
Mm,
there was no significant difference between clopidogrel rapid uh, metabolizer and the clopidogrel poor and intermediate metabolizer in terms of the clinical outcomes.
interesting. And what proportion of patients in South Korea undergo intracoronary guided procedures using IVUS or OCT?
Yeah. In complex patients, about half of the patients undergo intravascular imaging, IVUS or OCT. But in nationwide, overall, 30 or 40 patients undergo IVUS or OCT in overall.
So higher than in the US, maybe lower than in Japan. So lot of well done imaging in this trial. Well, thank you so much, Joo Young. This is what I think one of the more important findings at the meeting. Thanks for sharing with us, and thanks to all of you for joining us here live from ACC 2025.